What are the metrics that are currently being used to keep the mandates in place? And so we'll start with that first question, sir.
Although we would all like COVID to be ended, over the last 5 months, between January and May, we have had 10,000 people losing their lives and 60,000 hospitalizations, which is much larger than before pre-2022. So the rates of hospitalizations and deaths, unfortunately, have increased over the last few months, and we are following that closely.
So we've heard from infectious disease specialists over the last few days, and I appreciate the numbers that you've offered with respect to cases and mortality. But infectious disease experts have said that the mandates are not contributing to the prevention of loss of life. And these experts, like Dr. Isaac Bogosh, who offered, quote, "At the end of the day, the current policy probably isn't doing a whole lot," end quote. Do you agree with these expert infectious disease specialists, Minister?
Experts do indeed point to what you allude to, MP Barrett, which is the fact that we need to use all tools available. This is obviously a disease which can be serious, but it's also a disease that can be prevented. It, by definition, being a communicable or transmissible disease, it can be stopped. At least the incidence can be reduced through all sorts of tools, including vaccination and other ones as well.
We've seen that and heard again from infectious disease specialists that the policies that are in place lag the science. And we know that uptake on what is currently known as full vaccination is exceptionally high in Canada. But we all now also have naturally acquired immunity in addition to that first and second dose that an overwhelming majority of Canadians have received, as well as approximately 50% of Canadians that have received third doses. But aside from incremental changes to uptake on the vaccine, the mandates that are in place are not driving further vaccination. So on what date do you expect that you will lift the vaccine mandates? Or is there a target in terms of further vaccination that your ministry has selected that needs to be achieved?
Great question, and about great questions, Pearl. Let me speak to the one on the how and when we revise those decisions. These decisions are revised every week. We have meetings of the COVID-19 committee every week. We obviously depend on the experts, the data, the science, and obviously the prudential principle, which is that this disease has come with surprises ever since we came to know about it 2 years and a few months ago. On the vaccination rates, you're right. No, we can be proud of the in terms of the third rate, the third dose, which is essential according to all experts to protect us against a continuation of COVID-19.
So, Chair, there was a bit of an interruption in the minister's connection there, so I didn't hear the complete answer. But I'm going to continue. It looks like it's restored. So, as we don't have, we haven't been provided, Canadians haven't been provided with a further target. We have heard that a date for mandates with respect to the border for when they will expire. Do you expect that they will be extended, and what is the data that specifically that's being used to justify an extension or a termination of that mandate that's currently set to expire at the end of this month?
And as we said, the timeline is reviewed every week, so it could be any time. It could be later, and that depends on the evidence and the advice that is provided by experts within PHAC. If obviously you might want to speak to Dr. Tam eventually, because she will have more precisions on the type of regular meetings that she's having with her own officials.
I want to follow up on some of my questions to the Minister with the Public Health Agency of Canada with respect to the June 30th timeline and the restrictions in place at the border. Are you able to provide us today with the metrics that are being used to sustain or to allow those restrictions to expire at the end of the month, please?
Mr. Chair, I think one of the things which I would say in essence is that we have metrics which we use regularly in terms of how do we provide advice. The guidance advice is based on scientific evidence which is available on effectiveness, availability, and uptake of vaccines. What is evolving domestic and international epidemiological situation, and the effectiveness of other public health measures to keep the people safe. So there are a few of those metrics which are actually looked into in terms of the making sure that we have taken every reasonable precaution and to protect the health and safety.
Yeah, I appreciate that, Doctor. What I'm looking for specifically is if you can provide what the goalposts are, so Canadians know when we've got the touchdown. So before we talked about a 2-dose series of the COVID vaccine, and we had wild uptake, very positive uptake on that. We haven't seen the same with a 3rd dose. But now with natural acquired immunity from Omicron, with the portion of the population that has had a 3rd dose, with the well over 80% of Canadians that have had a 2-dose series, are we talking about vaccinations as the metric that you're using, or is it about wastewater surveillance? Is it about hospital capacity? And what I'm looking for, instead of hearing what the basket of areas that you're examining are, do you have the numbers that you have advised that you're using to advise on? And if you have them, are you able to provide those to this committee?
So, Mr. Chair, as I mentioned earlier, these criteria, as mentioned earlier, are the main ones which we use. Of course, we do take into consideration the wastewater surveillance. Of course, we take into consideration all the other factors which are mentioned. We are continuing to kind of look at that in a global epi context. There aren't any firm numbers or anything which can really be pinned on to that. This is it depends upon how much is the coverage of the vaccination, what is our current public health measures, and what it is in terms of our hospital capacity. So all of them taken together, we do the modeling which is presented, and based on that, we continue to and put together all of those public health measures, which includes vaccination, recommending 3rd dose as per the National Advisory Committee on Immunizations advice. So quite a few of those are continuously in essence.
And I understand that, Doctor, and that's the similar answer that we've received from PHAC over a period of time. But really, there has to be a number at which that you've identified at which it would be acceptable in each of those epidemiologically important categories, that then you would make a recommendation that now is the time to lift the mandates. So in each of those areas, are you saying that there is no number in hospital capacity, there is no number in wastewater surveillance, there is no number in community transmission, there is no number in vaccination uptake, there is no number in terms of community spread in other countries, that once those numbers are hit, that it would be safe for vaccine and mask mandates to be lifted?
Mr. Chair, what I am actually mentioning is that all of these variables, they are taken into consideration.
We understand that, sir. But what are the numbers?
As I mentioned, Mr. Chair, this is a combination of different metrics. There aren't any specific numbers which we could actually say, because it depends upon the activity of the virus in the different communities, as well as the different settings, and also the protection which is provided to the population from vaccination and other public health measures like masking, hand washing, and others. So there's a multitude of combination of factors which allows us to take those kind of public health advice.